Q&As about dizziness,
3366.
falls,
We invite
as a
your
side effects
questions
of
about
some medications.
medications that might
You need to
increase
know
the
which
risk.
medications can make you this dizziness and
Again,
falls. It's
that
very
phone
important
number
episodes,
for you,
nice
888
stories, Q&A,
472
very interesting. I invite everybody to follow. Okay?
You're listening to the People's Pharmacy with Joe and Terry Graydon.
At Medcan, we know that life's greatest moments are built on a foundation of good health, from the big milestones to the quiet wins. That's why our annual health assessment offers a physician-led, full-body checkup that provides a clear picture of your health today and may uncover early signs of conditions like heart disease and cancer. A healthier you means more moments to cherish. Take control of your well-being and book an assessment today. Live well for life. Visit medcan.com/moments to get started.
You're a podcast listener, and this is a podcast ad heard only in Canada. Reach great Canadian listeners like yourself with podcast advertising from Libsyn Ads. Choose from hundreds of top podcasts offering host endorsements, or run a pre-produced ad like this one across thousands of shows to reach your target audience with Libsyn Ads.
This is a very
Email
important
Bob at
Q&As,
libsyn.com to
stories
learn more.
about
That's
dizziness and falls as a side effect of
BOBLIVSYN.com.
some medications. You need to be aware of which medications can do this. It's a very important episode. I invite everybody to join and have an idea.
People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared, drug-free treatment for nasal congestion and runny nose. A sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Today we're talking about FRID, F-R-I-D. Is that acronym new to you? It was for us. It means full risk increasing drugs.
We invite you to share your story about a medicine that might have made you feel, woozy or unsteady. Our number, 888-472-3366. Again, if you'd like to join our conversation, we are live in the studio, 888-472-3366.
And Joe, we have a comment from Jeannie. She says, I'm 80 plus years old, and at this point I'm taking no prescription drugs because every one of them has side effects. I have high blood pressure, 142/70, and my doctor wanted me to take losartan. After reading the side effects, I decided the answer would be no, because it can cause dizziness. It can also lower your heart rate, and mine's already low. I average 40 beats a minute, and when I'm asleep, sometimes it's 30 beats a minute. Taking losartan means I could fall and maybe break a hip. Some seniors
Very
who break their
important
hips have
episodes,
died within a
stories,
year because of
Q&A
stress
about
on their
lots of
bodies.
side
Why
effects
would I want
of
to
some
treat
of the
one
medication
problem
used for blood
another
pressure and
problem?
others. You
Very
need
good
to know
point.
how to manage
You need to
feeling
point out.
dizzy
Yeah.
and prevent falls.
Balancing act,
You
Very
right?
do have
important
to do the
episodes to
balancing
follow.
act. It is critical to
You can
keep your blood
subscribe,
pressure
like, and
under
share with all of
control.
your friends.
We don't want anybody allowing blood
Please
pressure to
subscribe.
skyrocket. But sometimes trying to get everybody down to below 120 over 80 can lead to dizziness, especially something called orthostatic hypotension. It's when you stand up suddenly and then all of a sudden you get dizzy and then you may fall. And that's because of the blood pressure medication. So as Dr. Farley said, you want to make sure you talk to your doctor about drugs that don't make you feel dizzy. Again, our phone lines are open. 888-472-3366 is the number to call if you have a story to share.
And we go to Arlington, Texas to talk to Ann. Ann, your question, please.
Hi, this is Ann. I was wondering if I only take Synthroid in the morning before I eat, but I'm dizzy right when I get up, and then I'm kind of dizzy until I eat more during the day. Well, how do I figure out what's making me dizzy?
Good question, Ann.
Well, first, are you taking any other medications besides Synthroid, which is a thyroid medication, right, Ann?
Yes. Just later in the day, I take hydroxychloroquine and some supplements, calcium and that kind of thing.
Usually we don't think of supplements as causing dizziness. And generally speaking, Anne, I wouldn't expect Synthroid to cause much dizziness either. This sounds like you may need to have a more in-depth conversation with your doctor.
I'd have to look up hydroxychloroquine, Terry.
Yes.
Because, it is a drug that is prescribed. It's an old-fashioned medication. It's sometimes used for arthritis symptoms, for example, or other autoimmune conditions. And so it's not clear to me if that could be a contributor, but you definitely want to be very careful when you get up in the morning, and so that you don't, on your way to the bathroom, for example, have a fall. So that's a critical issue to bring up to your doctor whenever you get a chance, okay? Thank you so much for your call. Bye-bye. Terry, it looks like you've got Bert in Clearwater, Florida.
Let's go to Bert and find out what's on his mind.
Hi, Bert.
Hey, Bert.
You there?
Hello, yes,
Go ahead, please.
I'm here.
What's your question?
I was just calling in to say that with respect to dizziness, I've had some problems with taking Flomax and drugs for similar kind of problem, and that I find that, like if I'm sitting on a couch or something like that, I'll get up and I'll be dizzy and have to put a hand out and steady myself
That's
for a few seconds or whatever until that goes away, and then it'll go away, and then I go ahead without what I'm doing. But
Bert, you're describing
You're
describing a classic case of orthostatic hypotension. That's the doctor's term.
Do you know what's orthostatic hypotension? Orthostatic hypotension, or orthostatic decreasing of your blood pressure when you stand up quickly. So listen to this episode. It will have lots of stories, Q&As about dizziness, side effects of some medication, and how to manage and how to prevent falls. It's a very important episode.
For stand up, oops, feeling dizzy, and what that means, quite honestly, is that you're going to have to get up from the couch cautiously. So don't ever stand up suddenly and start walking, because you might end up on the floor.
Bert, did we interrupt you before you were finished with your story?
No. I think I got everything out.
Okay.
Good.
Well, excellent. Be careful. And we do understand that sometimes Flomax is essential to help you not have to get up 3, 4, 5 times in the middle of the night to go to the bathroom. That's when it's especially important to be careful if you do get up to go. So thanks for the call. Let's just give the phone number again, Terry.
Absolutely. 888-472-3366. That's our number. We'd love to talk with you and hear about your experience. And let's talk to Janet in Pittsboro, North Carolina. Janet, tell us your story, please.
Hey, how are you?
We're doing well.
I am good. I'm prescribed quetiapine, which is also called sertraline, to help me sleep. I have a problem with insomnia. And the prescription is 50 milligram tablets. And it says take 3 to 4 tablets by mouth. That's an overdose to me.
Yeah.
And right before that, I took 1 5 milligram diazepam, and I fell. And I had fallen last October, a year ago, almost exactly a year ago, in formaldehyde dust left in my house by a contractor, and I broke my femur. And that was a disaster. I mean, I was in ICU for 10 days, but that didn't involve a drug. That involved trying to clean up this dust.
Uh-huh.
But now, it was other day, September the 9th, I think.
Well,
But I was dizzy when I got up.
I understand, Janet. We actually would like to make some comments on what you've told us, and we'd like to remind everybody that when you want to talk to us, on the show, you need to turn off your radio because otherwise it will be distracting for everyone. So Janet, I'm gonna hang up here, and we're gonna make some comments about the diphenhydramine and the sertraline that you have been taking.
I thought I also heard her say something about diazepam.
I didn't catch that, but it might have been there.
I thought I heard that.
But-
and that would be, of course, a benzodiazepine.
Sertraline is one of the medications that Dr. Farley was talking about that put an older person,
It does sound that way.
put older people at risk for falls. Joe, we were talking about drugs that are prescribed. Sertraline is a prescribed antidepressant. Obviously, Janet's doctor is prescribing it for her sleep. That's an off-label indication.
I'm having a hard time understanding that. And she said 3 or 4 pills, and I'm thinking,
oh, whoa. Yeah, that doesn't
compute.
sound like a good idea.
Well, first of all,
But diphenhydramine, Joe, in combination with sertraline or even by itself. Tell me about diphenhydramine.
well, of course, we're talking about Benadryl. We're talking about the PM in Tylenol PM.
And a lot of people who have trouble sleeping will take this medication, which is over the counter. You can take it every day without even telling your doctor, but we like to suggest you need to tell your doctor.
And we'd also like to suggest that if you have to get up in the middle of the night to go to the bathroom, it would not be a good idea to take any of those PM pain medicines because they could make you woozy, at 3 a.m. when you get up.
And sertraline as a
Please
sleeping
subscribe.
pill, if you're susceptible to falls, is a bad idea.
Well,
Get your doctor to give you something better.
Let's talk about the beer list, and we're
Let's
not
do.
talking about drinking beer.
Right. No, we're not. We're talking about a gentleman whose last name was Beers, about this type of problem.
It was spelled Beers, Dr. Beers. And before we do that, Terry, what's the phone number?
The number is 888-472-3366. And Joe, tell me more about Dr. Beers and his list.
Well, he created a list many decades ago, and he said to his colleagues, doctors, don't prescribe drugs on my beers list because it will make them vulnerable to lots of problems.
So the drugs that Dr. Beers put on his list are drugs that are potentially inappropriate for older people, and sometimes referred to as PIP, potentially inappropriate prescriptions. But basically, we're talking about older people because they're more vulnerable to problems with certain drugs.
Well, what's become very popular these days is a category of drugs called gabapentinoids.
And we've got a comment on that from Facebook. Would you like to hear it first? And then you can launch into your...
I would like to hear it.
Yeah, okay. Mary Jo wrote, I'm a paramedic. I have a question about Neurontin. People are prescribed this all the time for their peripheral neuropathy, which makes them a fall risk anyway. But when elderly people consume it, they have a bigger risk of falling. And I can't read the rest of Mary Jo's comment, sorry to say. So,
Is a
paramedic.
So it's likely to be in that emergency.
She gets called when somebody falls.
When the ambulance comes, that's Mary Jo, and and that's gabapentin. It's pregabalin, Lyrica. She mentioned Neurontin, and these drugs are now being prescribed so widely for pain, especially for nerve pain. So gabapentin is the number 5 most prescribed drugs in America today. So many people are in pain and they can't take opioids because their doctors are afraid of them or they're afraid of them, and as a result they're put on gabapentin, and it can make people vulnerable to falls.
It can definitely do that.
That number again, 888-472-3366. If you'd like to join our conversation. Are you taking 1, 2, 3, maybe 4 blood pressure medications simultaneously? How does that affect your level of dizziness. We'd love to hear from you. Again, that number 888-472.
You can leave your question here. I will answer it myself concerning any medications you are taking and what the side effects are, and if there is any interactions between any medication you are taking. We're talking about dizziness and falls as a side effect from medication. Please like, subscribe, and share with all of your friends and families. So if you have a question about anything related to pharmacy, you can leave it in the comments.
Now, your story, please.
I am taking 2 blood pressure medications, and at the time, amlodipine, and my doctor prescribed hydrochlorothiazide, and that made me dizzy, and I passed out. I walked outside. It was sunny. It was warm. Went to the ground.
Oh, my.
Fell to the ground.
And
I called him and told him
were you
he changed the medication to metoprolol.
Okay.
metoprolol,
Right.
a beta blocker?
Metoprolol, yes.
And were you able to get up and manage to not break any bones on that fall?
I did not break any bones. I'm
Oh,
59 years
goodness.
old.
Okay, so
I
you're
mean,
the people who are most likely to break bones are the really older people, 80 and older. So we're glad you didn't break anything, and we're glad that you realized that the drugs causing your problem were your blood pressure medicines, and you got your doctor to change the prescription. Good work, Peggy. Thanks for calling.
We appreciate it.
And Joe, we're getting close to our break, aren't
Oh, we got lots of time.
we? Okay.
I think it's been so long since we've done a live show, we kind of have forgotten the time cues.
Yes.
Al, we're still good, right? Yeah, we still
I think
have
we're fine.
2 minutes.
Okay.
So, shall we go to Herb
Sure.
in Research Triangle Park, North Carolina? We can just squeeze Herb in.
I think we have enough time to talk to her.
Herb, what's the story?
Hi, Terry, Joe. Good conversation. I don't know what to say. Here it is. I have a 97-year-old mother who has no issues other than she is not 120 over 80.
Oh my.
So he has been prescribed amlodipine, Lasorda, those kind of things. I have been fighting this battle for some time. So what I would like to say is that your audience, don't give up the fight. Don't give up the fight. What I did was I said, look, when she goes into to see the doctor, she's excited because she gets the white coat syndrome. So what I do is I have
White coat syndrome. White coat syndrome. This is when your blood pressure go high because of the stress when it is measured in the doctor's office. There is some tips and some tricks. They will tell you how to manage this one. Please listen, subscribe, share, comment with any comment or questions.
trying to do good does not always end up being good for the 97-year-old mother. And I thank you all so much every week for what you do, and I also do your subscription as well.
Herb, thank you
Thank
so
you.
much for that call, and thank you for watching out for your 97-year-old mother. The fact that she uses a walker is very smart, and the fact that you are taking her blood pressure, making a record of it, so that you can show the doctor what her blood pressure is like at home. That makes a lot of sense.
Well, this idea of white coat hypertension is something that I think a lot of people have to struggle with because, they have to drive to get to the doctor's office. If there's traffic, it can be very anxiety producing. And then the question becomes one of how well is your blood pressure taken at the doctor's office? When we come back after the break, we're going to ask you to give us a call about how your blood pressure has been taken. So there are some guidelines from the American Heart Association. You're supposed to, number one, be allowed to rest quietly for about 5 or 10 minutes when you get to the doctor's office. You're encouraged to go to the bathroom and pee. And then when you get into the office, they need to make sure that they take it correctly, that you're not sitting on the exam table with your arm dangling down, that you're in a chair with your arm supported. Has that happened to you? I'm curious. Have you been encouraged to follow those guidelines, or did they just take your blood pressure as soon as you walk in the door? Give us a call. Tell us about your experience with white coat hypertension. Our lines are open at 888-472-3366. You can send us something through Facebook.
That's right, Facebook. We're at People's Pharmacy, and that's how we got Mary Jo's comment. And we will talk more about drugs that increase, but we'll especially get to the blood pressure.
888-472-3366 is the number to call.
Do you know what are the risk factors when you take blood pressure medication and some other medications? Do you know what dizziness can be a side effect from some of the medications? Do you know that falls in old age is really risky and scary? Lots and lots will be discussed in the next segment. It's very important to listen to if you are interested. Please subscribe to our channel and get you lots and lots of these podcasts, and we can discuss anything you want. Write me a comment and I will answer all of your comments and answer all of the questions related to pharmacy or any medications or drug interactions. I'm willing to answer all of your comments when it is related to pharmacy and related to dizziness and falls during this episode. Thanks and enjoy the rest of the segment. Subscribe, like, share, and comment.
Do that, but there are some tests that they use to see how people can get up out of a chair and that sort of thing. So there may be some assessments.
Well, you know, physical therapists do this all the time.
That's true. They check your balance.
And doctors should be trained so that they do know how to test not just an older person, anybody, for a fall risk, especially if they're taking more than one or two medications. And I suspect that if you were to ask a lot of nurses these days, when a patient comes in, how many drugs are they taking? I bet the average is more than two.
Especially if someone is struggling with high blood pressure. Now, I love the idea that Herb suggested a few minutes ago, that you should take your blood pressure at home and keep a record of it so you know what it's like throughout the day and you can share that with your doctor. That's important.
And you know, does a 97-year-old woman need a whole bunch of medications to get her blood pressure under 120 over 80?
The idea is that you're going to increase longevity, but once you get to 97, I don't know that you're aiming for greatly increased longevity. She's already there.
The risk of a fall
is significant
and worrisome.
Yeah.
I remember my mom went in to see Dr. Bob Gutman, who was an internist, and he said, "Helen, I could get your blood pressure down to 120 over 80, but you'll feel bad. And are you willing to take the risk for a stroke and let it be a little higher?" And she said, "Yes, Dr. Gutman, I'm willing." And she lived to 92 and died from a medical mistake.
But she chose not to have a fall because the idea of a fall frightened her.
It sure did. You have a story from Jane.
I do have a story from Jane, and then we'll go to the calls. Jane said, "I worry about how often doctors put people on blood pressure drugs based on one reading at the clinic. Way too often that reading was gotten by totally incorrect methodology. Like many people, I have white coat hypertension." And Joe, when we're done with Jane, we'll ask you to explain that. "I now take a chart of at-home readings covering the last 10 days to 2 weeks of several readings a day. Even though these are perfectly fine numbers, I still have to fend off the doctor wanting to start me on meds based on the somewhat high reading at the office. Also, in the last 20 years, my pressure has been taken correctly only 2 or 3 times. I wonder how many people are dutifully taking their medication every day based on a single reading done improperly at the doctor's office, and therefore are perpetually experiencing low blood pressure or maybe dizziness at home. I suspect a fair number of falls, appearances of cognitive decline, etc., are the result of this unfortunate dogma. So we appreciate Jane's comments.
We surely do. And this idea of white coat hypertension has been controversial for decades. There are some people who say, oh, that's all nonsense. If somebody has 130 over 90 in the doctor's office, they have to be treated, even if their blood pressure is 120 over 80 at home. I think that thinking is starting to disappear. I hope it is, because a lot of times these days people are not getting their blood pressure taken correctly.
Let's talk to Patricia in Wilmington. She's got a story about a drug we haven't mentioned yet. Patricia, welcome to the People's Pharmacy.
Thank you. Hi. Yes, first-time caller. My husband is 86, and he takes many drugs for a variety of issues. But one of the drugs that he's been prescribed over the years is Viagra.
Mm-hmm.
And I'm not sure why 86 you still need to be taking Viagra, but that's a whole nother story.
Mm-hmm.
Sometimes he'll take more than what's prescribed because he's not getting the effects that he wants. So he'll take 2 or 3. And that's caused him to get dizzy and lightheaded. And so I plan to go to his doctor with him the next visit to have a discussion of Viagra and also the importance of taking just the prescribed amount and not what you think you need.
Such a great comment, and I don't think people actually appreciate that Viagra can make you dizzy, especially in combination with other medications, or if you take more than the prescribed amount. So, Tricia, we really appreciate this.
Yes,
comment.
that voluntary dose increase of 2 or 3 Viagras would definitely be problematic. The dose is 100 milligrams, so if he were taking 200 or 300 milligrams, whoa.
And of course, falling would be the least romantic thing you can possibly think of.
Exactly. So yes, definitely discuss with his doctor this potential problem.
And we've got a call from Ken in Meadville or Meadville, Pennsylvania.
I bet it's Meadville. Is that
I
right?
imagine so.
Ken?
Yes, you are, Joe. Meadville.
Yeah, I grew up in Pennsylvania. I went to Penn State, and there were a bunch of kids there from Meadville, Pennsylvania. What's the story?
Well, I'm 79, and I'm on a medication called Nadolol, 20 milligrams. I guess that's a beta blocker, but it be used for blood pressure too. I wondered if that. I missed the first few minutes of the show. I was wondering if that was one of the ones on the beers list, and I'm having severe balance issues. I wouldn't call it dizziness, but I can't seem to walk down the sidewalk when I'm out walking straight. I kind of wander back and forth. I can't stand on one foot. I've always been athletic. I still can play table tennis quite actively.
Well, let's start at the beginning. You're taking a beta blocker, as you have pointed out, Nadolol. And to be honest with you, physicians have generally moved away from beta blockers for high blood pressure as the first line approach. In fact, I can't say off the top of my head if Nadolol is on the beers list, but I can say quite confidently that most physicians would not start with a drug like Nadolol to control blood pressure. And so even if you're not quote unquote dizzy, if you're unsteady on your feet, it is absolutely time to be in touch with your doctor and say, let's try something else. And, you know, that something else might be a drug like a diuretic. It might be a medication like an ACE inhibitor. But you definitely need to talk to your doctor, because if you're feeling unsteady, if the possibility is when you're walking on the sidewalk or someplace else and you fall, it could be a disaster. So Ken, thank you so much for calling. And please do follow up with your physician as soon as possible.
We go to Richmond, Virginia and talk to Ann.
Absolutely. And our numbers are 888-472-3366. We just have a few minutes before we have to sign off. We'd love to hear from you, especially blood pressure has been taken in the doctor's office. Has it been done correctly? Has it been taken by a nurse, a doctor, or a technician? Did your arm get supported at chest or heart height? Because a lot of times your arm will be dangling or it's not supported. That can affect your blood pressure reading. But where are we going? To Richmond, did you say, Karen?
Yes, we're talking to Ann. She's been waiting to make her comment or ask her question. Go ahead, please, Ann.
Have been treated with lots of different meds. But the longest one is latanoprost and also the gozolamide, timolol. I wonder if there are any eye meds that I should be careful of for dizziness, because then
and that's a brilliant question. And thank you so much for asking about eye meds, because I think a lot of times people assume, oh, well, if I just put a drop in my eye, it's just going to stay in my eye. It won't have an impact on the rest of my body.
But timolol, for example, we know for sure that it can have an impact. And it's possible that latanoprost also does.
Well, timolol is a beta blocker, and we just ended up talking about beta blockers. And so you should definitely talk to your doctor about this if you are feeling somewhat dizzy as a result of your eye drops. So, when you put eye drops in your eyes, they just stay there. They circulate through the rest of your body.
Now, of course, you do need to treat your glaucoma.
Absolutely.
So you and your doctor are going to have to come up with a regimen that will work for the glaucoma and not put you at risk of a fall. So good luck with that, Ann. We sure hope you come up with something helpful. And Joe, did you want to talk to Eric in Charleston, West Virginia?
Absolutely. Eric, welcome to the People's Pharmacy. What's this about?
Well, good morning. Yes. I had two items, actually. The cuff was interesting because at one point I went to my GP and the nurse came out and took my blood pressure, and it was way up, way too high. Then the doctor came in and said, we used the wrong cuff. Your arm happens to be a little larger than usual, and therefore we need to give you a big cuff. And so he took it, and it came back at least 10 points lower than what it was. So it seemed to be very important to pick the right cuff, especially if your arm is larger than normal.
Absolutely, Eric. And the same thing holds true if your arm is extra small. You need the right size cuff, because if your arm is extra small and they use an ordinary cuff, your blood pressure reading is going to be a little bit too low. And Joe, we got a Facebook comment from Karen who says, I think something needs to be said about the devices being used to check blood pressure nowadays. I'm 65. I've had great blood pressure around 120/70 my whole life. But about 15 years ago, I noticed that my blood pressure registers higher in the doctor's office, and it probably has something to do with the cuff.
Well, the cuff is one of those things that is often not even considered. I mean, because if you're the patient and you walk into the doctor's office, they slap the cuff on your arm, they never measure your arm. So if you have a very small arm or a very large arm, I mean, imagine a guy 6 feet 4 inches tall, weighs 250 pounds, lifts weights, he's going to have a gigantic bicep. And if they use a standard cuff on him, it will be an inaccurate reading. When's the last time you ever had your arm measured before you had your blood pressure taken?
Well, let's talk to Phil in Clearwater, Florida, because he's got some stories to tell. Hey, Phil.
Hello, how are you today?
We're doing well. What's up?
Well, I just wanted to give comments. I concur with you that a lot of physicians or their staff do not let you take time. Like sometimes I go to the doctor's office and, I've showered and got ready and I ran in there and then they take you back and boom, they take your blood pressure right away, and it's elevated. And then they say, well, I'll take it again. The doctor takes it like at the end of the exam, and it's back to normal. Same thing happened to my wife. She went there, and I swear they want to put a diagnosis of hypertension in your chart so that they can charge more to the insurance companies or whatever. But I don't know if that's true or not. That's my hypothesis. But I just think you need to take control of your own body, your own medication, and tell them, no, I want you to wait 5 or 10 minutes. Let me relax here a second. So it's stressful enough going to the physicians anyway. But on top of that, I think they're not always doing it correctly. So I concur with what you said.
And there's one other thing, Phil. You should never talk when you're having your blood pressure taken, because if the technician or the nurse starts to ask you questions like, how are you doing, or what's going on in your life, or some other medical question, talking will raise your blood pressure.
Joe, in fact, we got a Facebook comment from Renee who says, for white coat hypertension syndrome, show the nurse a note that says, no talking until after I weigh, relax, and they take my blood pressure. They rush you and they want to ask you all kinds of questions and show their incompetence before taking my vitals.
That was
Thanks
not
for
nice.
that, Renee.
Yes, and always go to the bathroom. You're supposed to urinate before you have your blood pressure taken.
I don't believe I have ever been asked if I needed to use the facilities.
I've never had that happen to
Joe,
me either.
do we have time to talk to Johnny in Fort Worth, or
Very briefly,
we're
Johnny,
almost out of time?
we have just a minute or two left. Go ahead, quickly.
Hi, I take a hormone drug. I have prostate cancer, and I also take 4 pills a day. I've lost the 4 pills a day, but I've noticed that when I'm driving, sometimes I have an urge. I get anxious, and I'm just trying to figure out what's going on. My blood pressure is usually runs about 140 over something, but that's my issue, and I'm trying to think. I've been trying to work with my oncologist, trying to figure out what's going on. Thank you.
You will need to work with your oncologist, because obviously it's critical that you keep your prostate cancer under control with your meds, but you don't want to be dizzy while you're driving. So that's a critical point to bring up to your doctor. Well, Terry, we are just about out of time. I am so grateful for all of the calls we've had from all over the country.
And Joe, we have one more comment. I think we have time for it. Jan says she's a nurse in the emergency department. A woman brought her mother in because she was dizzy and nearly falling. Her doctor had prescribed a benzodiazepine, Librium, the day before her visit to the ED. Remember, Jan's a nurse. She says, I informed the ED physician that her symptoms started right after she took the first dose, and the physician said it couldn't be the medication because the dose was too low. He told her to call her doctor the next business day, which was 2 days from when we saw her. Her daughter was afraid to leave the patient alone at home, of course. Providers need to improve the medication reviews when patients experience falls.
Absolutely.
And that is very good advice from a nurse.
Thank you so much for that, Jan. Well, that is all the time we have today. Thank you so much for listening and sharing your stories today on the People's Pharmacy.
Absolutely. And the People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta provided technical assistance. Al Wodarski, the great Al Wodarski, engineered. Dave Graydon edits our interviews, and the People's Pharmacy theme music is by B.J. Liederman.